The focus of this talk is local anesthesia for facial rejuvenation procedures. I hope this gives the viewer a kind of a basic idea of what to expect with local anesthesias with oral sedation, which is my preferred anesthetic technique for almost all of my facial rejuvenation procedures, including brow lift, blepharoplasty, facelifts, chin augmentation, liposuction, fat transfer, chemical peels, laser resurfacing, on and on and on. Before we dive right into the meat of the subject, I think it is imperative that we kind of talk a little bit about the different types of anesthesia and how we make these decisions. So essentially, anesthesia can be broken up into two main categories. One is local anesthesia. Local anesthesia is very similar to what you get when you go to the dentist, where there's a nerve, we numb the nerve, and then you have no sensation in that area, and the surgeon is able to perform the surgery without problems. The other type of anesthesia is general anesthesia. In this type of anesthesia, the patient is most likely at an outpatient surgical facility or in hospital, and the entire body is anesthetized so the patient has no recollection at all for the procedure. There's a lot of different variations of these types of anesthesia. However, these are the two large categories. Before we decide what type of anesthesia is best for the patient, we really do need to get a little bit of information about the patient. Past medical history, any surgical histories, any allergies, any bad effects that have happened in the past during anesthetic procedures. All of this information is kind of put together into some sort of a algorithm, and then we come out with what is the best anesthetic option for that patient. Most of the patients that I end up operating on are healthy patients with no medical problems who have had a surgical procedure in the past or a dentist procedure in the past, so they have a somewhat of a mental idea of what surgery or what a dentist type procedure feels like. If that is the case, my preferred type of anesthesia for these types of patients is local anesthesia with oral sedation. What that means is essentially that I give a bunch of medications by mouth, and these medications do several things. One, they bring the patient's nervousness and anxiety level down. Two, they reduce the amount of pain that the patient feels overall, and also some other medications to make the patient a little bit more relaxed and maybe even a little bit drowsy. Once these medications are on board, my next main goal is to actually numb up the face. So I essentially block the face by injecting numbing medicine at the major nerves, which takes out the vast majority of the sensation of the face, and then go in there and actually infiltrate some of the intervening areas so that there's essentially no sensation from here to here. The patient is awake, patient can follow directions, and I feel that patients get several advantages by this type of anesthesia. Number one, the patients seem to recover quickly or more quickly, have less issues with postoperative grogginess, drowsiness, vomiting, those kinds of issues. I find that patients have less overall bruising and swelling with local anesthesia. And this makes sense because a lot of the medications that we give for general anesthesia actually make blood vessels open up or vasodilate, causing bruising and swelling. However, this may not be the ideal anesthetic choice for all patients. Patients who have significant medical histories, patients who have significant anxiety disorder, panic attacks, these types of things are really important to know up front because those types of patients may be better served by undergoing general anesthesia or IV sedation, where there's a lot more sedation on board so that the patient really feels nothing and is not having any recollection of the event. One main thing or caveat that is extremely important to remember is safety. I do not think that the safety card is a card that needs to be played by promoting local anesthesia or general anesthesia. The safety of both of these anesthetic techniques is relatively equivalent. I do not feel that local anesthesia is overtly safer than general anesthesia or vice versa. So this should not be a focus of how the decision is made regarding to which anesthetic technique is going to be used on a patient. There are some safety concerns. For example, a patient with a significant past medical history may need to be done in the operating room, but still under local anesthesia. They're all variations of such. But in the large two categories of local versus general anesthesia, I don't feel that there is a significant safety of one versus the other. And I really did want to make that point very clearly and not simply gloss over that. I hope this has given the viewer a lot of information about local anesthesia and why I prefer local anesthesia to general anesthesia for facial rejuvenation procedures. If you have any questions, concerns, thoughts, just want to get more information, don't hesitate to give us a call. Please subscribe to our channel and click the like button, and we hope to hear from you soon.